Addiction behavior that develops as a direct consequence of inadequate pain management. You don't treat the pain right, so they go running around to all sorts of places demanding pain management, usually opioids. Pseudo-addiction, because once you get a hold of them and manage them, they stop doing it. That's the theory. This is where it came from. A clinical note, not a study. This is by Haddix and Weissman. David Haddix used to be the medical director of Purdue Pharma. This was a case presentation. And that one case became a syndrome and in our lexicon. I'm guilty of this too. I have slides that show pseudo-addiction stuff. A major effort is needed to educate professionals regarding appropriate use of opioid analgesics and true facts regarding opioid tolerance, physical and psychological dependence. The recognition of pseudo-addiction as a true iatrogenic syndrome with a definable cause, natural history, and effective treatment will hopefully improve the way in which patients receive analgesic. One case report